men's health, especially when we look around cancer. Um, Part of what you want to look at are the incidence in cancer among Black men. That's what I'm going to focus on, is the incidence in cancer among Black men. Prostate cancer is nearly twice as common in Black men as compared to white men, and they are most likely to die from it. And mainly that's because of late stage diagnosis, meaning that you wait to be diagnosed by the cancer or by your doctor. And this is something that happens often with a lot of different illnesses. If you know someone that thinks that they might be diabetic, they wait to be diagnosed. If they believe that they might be uh, late in, if they believe that they may be overweight and the doctor had told them that before, they won't go to the doctor because they don't want to hear the bad news over again. If they know that they have high blood pressure, that it runs in their family, they won't go to the doctor because they don't want to hear the bad news. But the thing is, early intervention, getting in early, is what definitely helps to promote a greater ability for the doctors to help to treat you. And treatment early on is better than treatment later. As my mom used to say, my grandma, and I'm sure plenty of you can also do, um, is if you an ounce of prevention, and that ounce of prevention we can put in this term is that prevention that happens early on. That prevention that we do early is what makes a difference. So one of the things also that we also know is that colorectal and lung cancer, those are some things that are also diagnosed later on. And everybody, we've talked about this, and we're going to continue to talk about it. People are concerned about the preparation that it takes to get a colonoscopy scan, to get those tests done. And it's something that it can be done very easily. You talk to your doctor about your fears, and they will be able to help help everybody, help you find the treatment or find the prep that works best with your system. So the one thing that we want to make sure that you do is to not let your fears dissuade you or delay you from getting in to finding out if there is something wrong early on. Uh, Part of that is part of what we're going to talk about today, and I definitely want you to come in and join us in the conversation, ask your questions. We're going to have some wonderful guests here today. Um, uh, uh, we have actually prostate cancer survivor. You know, I always bring in guests that can talk a little bit about their experiences with getting diagnosed and their experiences in getting treatment. And one of the things, too, that I always like to bring to the table is someone who's experienced participating in the research. Because one thing to understand is that if you do not if we are not part of the research, then we are not part of the solution. And this is one of those issues that is always a concern. If we are not part of the research, we are not part of the solution. We are not part of the solution. So I want you to sit back, get your coffee, and come on in. Come and join us at the table with this conversation and help to liven up the conversation and get more information in. So as I mentioned, September is Prostate Cancer Awareness Month. And what we are focusing on this whole month is men's health. What we want to look at is the health of our, specifically targeting our Black men. And one of the things that I want us to pay attention to is that all of us, it takes a village, and all of us can help support our Black men as they get diagnosed with whatever it is, whether it's helping one another with diet, with food preparation, um, with getting to the doctor, with reminders. All of those things are really, really important. One of the things to also be really keen on is having a medical home. Whether or not you are looking for a primary care doctor, a clinic, or a hospital system, it is so important that you find that provider that you're going to be able to talk to and that you feel comfortable that he or she is listening to you, that they hear you, and that they take you as part of the treatment plan, that they take you as the center of focus for whatever illness or whatever that appointment may be for. And if you have specific questions, that doctor has a team that can also help make those decisions or help answer those questions. So one of the things that we want to focus on to just begin the conversation around men's health is a medical home. A medical home is is a location where individuals can seek their care. And whether that is with a big health system or with a federally qualified health system or center, which is some of our clinics that we have right here in Milwaukee, we are so blessed to have so many. There's 16th Street, Milwaukee Health Services, Progressive Community Health Center, Outreach Community Health Center. We have Health Connections. We have so many clinics that you can go and choose as one of your medical homes and get a doctor or a nurse practitioner who can be your primary care provider and provide that one on one care for you. And they do work as a team. They have not only the doctor, but they have nurses and medical assistants and others who can help provide care for you. And that centralized location, that one stop shopping for your medical care, is what is so important and so key. As we also begin to continue talking and continue looking at men's health, we want to look at what are some of the guidelines and what are some of the basic things that men should be looking at on a regular basis. I know when you're younger, um, we're really good about making sure that our young men get in for their physicals to play sports or to start school. We also make sure that we get into the dentist and get into the eye doctor. Those regular checkups are key and important. But we also, when we start to get to college, unless you're playing a sport, it starts to fall off. And those habits that start when you're young do not often continue. One of the things that I always say is one way to look at it is to give yourself something on your birthday. Many of us celebrate our birthday as a birthday month. And if you do celebrate that birthday month, you see your birthday coming up, then use that time as an opportunity to schedule all of your appointments during that month. I know it's not the best way to celebrate, and it may not be the most fun, but it's one way that you definitely remember that you need to go and get your blood pressure checked, go to the dentist, go and get your eyes examined, all of those important things. It can also remind you if you're of a certain age, if you're 45 or older, to go ahead and schedule that colonoscopy, schedule that way in advance. You can also schedule to make sure that you get your annual exam from your doctor. For men, that may mean that you do your PSA or get your prostate checked through a blood test. But that means what you're doing is setting a habit for yourself, setting yourself up so that you have a practice in place. For some things, like going to the dentist, you may want to do 6 months out because you should do that twice a year. Get your teeth cleaned twice a year. But just try to set a habit for yourself. And then also try to set a habit for those in your family. Set it as a reminder that you know that these are things that you need to do. This is where we come into that movement of accountability, that space where we can be accountable to one another and make sure that we are trying our best to have our best health, have our knowledge shared within our own families. And this is the piece that is so key and so important. Having the family take accountability for one another. And this is the support system that we have that is really key and also very important. When we look at some of the barriers and some of the things that often scare us about our health. It is getting that bad news. And sometimes the news, I know for me, when they said I had high blood pressure, that was something that made me a little nervous, because I know it runs in the family. And I know that we've had people in our family who've had heart issues because of high blood pressure. So I wanted to get ahead of it right away. And one way to get ahead of it is to make sure that you go to the doctor. Once I went to the doctor, I faced that fear. I've been on medication that has put that aside for over 10 years now, has not been an issue for me. Once you are able to address it accordingly and with the help and assistance of your doctor, it is always a lot better than trying to do it on your own. So I ask you, and good morning to you all for joining me this morning. You can call in with your tips, call in with your questions. That number, the call in number, is 414-444-5253 or 414-444-5250. Join us today. Ask your questions. And our focus today is pin, protect, and prevent. We're stronger together. We're focused on men's health. September is Prostate Cancer Awareness Month. And as you know, with this show, we are always talking about cancer prevention and cancer screening. And we want to make sure that we are here as your trusted messenger to dispel any myths and to address any barriers that you may have in getting health care. We are here in the community with you because we know that this is where it is most important to be able to address any issues that you may have about making sure that you are getting access to your care. And this morning, I told you we have several guests that are joining us. Um, and I do, as always, we have co hosts that join us. And we are blessed to have a co host with us today, Mr. Harrell. And Mr. Harrell is a prostate cancer survivor. And he is also one of our health griots. And he will tell us a little bit about being a health griot and what that means. And Mr. Harrell has also participated in research, and he'll talk a little bit about that. So we definitely want to bring him into the conversation so he can share with us a little bit about his experience and his knowledge. He is very knowledgeable, definitely very knowledgeable. Mr. Harrell, welcome to Your Health and You, uh, and want to welcome you and hope that you are here to join us. Oh, we got applause for you. Oh, look at Jermaine Pants. Hi, Mr.
Good
Harrell. How
morning,
you
Deborah.
doing? Good morning. Good morning. Good morning. Good
And
morning. Jermaine.
Jermaine.
Yeah.
Yes, sir.
Right. Good morning.
Good morning, sir.
And you met Debo. You
Yeah.
saw Debo on the way
Yeah,
in.
I know Devo.
You know Debo.
I know Devo, yeah.
See, we friends already because he got a Green Bay Packer hat on. So,
Oh, goodness.
we connected right
We
there.
connected
There
with
we
the
go.
Packers. Oh,
There
goodness.
we go.
Yeah.
Should I mention I'm a Steelers fan, or we going to let that go?
Are you out of there?
Cool. Well, Mr. Harrell, tell us a little bit about yourself, who you are, and definitely tell us who are the health griots.
Okay. Good morning, everyone. As you said, my name is Minister William Harrell. Um, oh boy, my journey. I had a journey. My journey went through a lot. I've done a lot. I've seen a lot, and I've been a lot of places. One place that I have been is um, college. I went to college, and I also was married for 5 years. And after marriage, I got into a street lifestyle. I was working, and I had a couple jobs, but I finally was incarcerated, and during that incarceration, the first incarceration, I had to take a medication called Zantac, and I didn't know, any background of the medication. The medication was for my stomach was
Mhm.
yeah, acid reflux.
Yeah.
Exactly. It was for acid reflux. And um, make a long story short, I was taking it when I my first what they call bit in prison, and um, I didn't know anything about it. The doctor just gave it to me, and I took it. I used the medication all while I was in prison. I was 3 years. They sent me to Oklahoma. I went all the way to Oklahoma.
Oh.
Yeah, yeah, because I was. They said I was doing dead time. Dead time. Yeah,
Mm.
and that means that when you're incarcerated, you have to go through program. So they have different programs like GED. I didn't need that, as I had a college degree.
Mhm.
Um, 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 AODA. I didn't need that. I had been through AODA 3 times already through treatment. Yeah, I had been through treatment before I got incarcerated.
Mhm.
And there was one more. There was one more that I wasn't eligible for. I can't remember. But anyway, but anyway, now each bed in the Department of Correction is a unit, and each unit is a number. Okay, I remember my number 387520.
Mhm.
Because you had to get up for count, you had to go for lunch for count, you had to go to evening count before you go to bed. And I remember my number, and it was just drilled into my head. It's like Social Security number. We all know our Social Security number because we have to use it so much. But, well, I had to use that number every day. And anyway, I went to Oklahoma, and while I was in Oklahoma, um, I got a, I got into a program since there was any programs in Wisconsin. And it was called the ABLP program, and that's applying basic life principles. And our textbook was the Bible.
Mhm.
So we studied the Bible every single day, twice a day, and that was our job. We got paid to do that. And it was better paid in Wisconsin. Wisconsin, you would get like 25 cents an hour. So right there, we were getting $5 an hour. So I was able to build up a little money when I got out. And eventually, I got out, and I hate to say it, but I relapsed, and they caught me again, and I was reincarcerated. And this time, when I was reincarcerated, I went to HSU, and
What's
HSU
HSU?
Human, I mean Health Service
Okay. Okay.
Health Service Unit. I went to HSU, and I went to HSU the first time, but had a clean bill of health. But this time, I went to HSU, and they told me that my PSA level was high. And so I went and talked to the doctor, and I asked the doctor, well, what are the what's going on? What's the consequences for this? And he said, well, your PSA level is a 13, and that's pretty bad. He said, we think you have prostate cancer. So they tested, and they tested positive. And then I asked, what are we going to do about this? And he said, well, you only have 18 months left, so there's nothing we can do. So I had to wait 18 months, a year and a half, for treatment. And I did. I prayed, and God carried me through. And I promised God, if He helped me through this, I wouldn't use anymore. So the 18 months was up, and I went to the doctor, and the doctor said, uh, test. They did the test again, and PSA level was 13. So 18 months, it didn't go up or down. So God, God did His part. So now I had to do my part.
Yes, sir.
So I got back into a Narcotics Anonymous, and I've been in Narcotics Anonymous now for 19 years. That's how long it's been since I got out of prison. But I found out that through going to clinics and reading the literature and everything that this medication I was taking was a carcinogen.
Mm,
It was a carcinogen. So now we have a lawsuit against Zantac for distributing the carcinogen in prison. And anyway, y'all know how the lawsuits go. We're still waiting.
mm,
But then I met Dr. C, and Dr. C was from Medical College of Wisconsin, and he was at Freighter, and he was a cancer doctor, and I think he's retired now, but back
mhm,
then he was the main man when it came to prostate cancer, and he told me he didn't want to take the prostate, but it looked like he was going to have to take the prostate. But it was up to me whether I wanted him to take it or not. He could try it. I told him, get it out of me.
mm.
And so he took the cancer out of me. I was afraid that I was going to lose my sexual ability. What me I'm worried about. But in the beginning, it did affect, but at the end, it didn't. It grew better once I did followed his instructions, did the exercises, got involved with Men Moving Forward, which is a
Well,
group.
that's if I'm going to stop you because we got to take a break.
Okay.
But thank you for the background because that is so valuable for people to know the background and see you now. And but then when we come back from the break, I want to pick up on the Men Moving Forward project and continue on your journey. So thank you. We'll see you on the other side. we left off, Mr. Harrell was telling about his journey. We've been joined now. You all remember this face. This is our good doctor, Dr. Kevin Izzard.
I have a face for the radio. Right?
Face for the radio. You are so wrong. Lord. I did not say that. I did not say that. Dr. Kevin Izzard, he is a family. He's part of the family here.
Mm-hmm.
And then coming in to join us, we have Dr. Melinda Stolley from the Medical College of Wisconsin. But I want to continue really quickly, and also Dr. Izzard to join in where you can. Dr. Melinda Stolley, you know Mr. Harrell. I will just do brief introductions. Dr. Izzard, family medicine physician, graduated from the Medical College of Wisconsin in '95. You finished your residency in '98. And you're also president of Cream City Medical Society. Dr. Stolley, Melinda Stolley, I can say the words, accomplished health psychologist and cancer prevention expert from the Medical College of Wisconsin. A good friend of the community. You all have probably all seen her before, out here doing good work, always doing good work, getting in good trouble. And the founder of the Men Moving Forward, Every Day Counts, a lot of stuff. A lot of stuff. But I want Mr. Harrell, and I want to go back. When you were incarcerated, you mentioned that your PSA was 13. You came out, and it was still 13 after 18 months. And Dr. Izzard, while he was incarcerated, he only had 18 more months, and they said, well, we're not going to do anything. And then he came out, and he said he prayed and read his Bible, and it did not go anywhere. It stayed at 13.
Amen. Like you said, God is good.
God is good.
All the time. Right?
So nowadays, because that was a while ago, but nowadays we call that a little bit different. Because some people, we do that. We wait and we watch.
Yeah. Especially if you said it was 13.
13.
Yeah, because 13 is not. 13 is high. It should be. We like to have it below 4. So 13 is high, but 13 is not. Set your hair on fire when you do something right away. So what we know about prostate cancer, and Mr. Harrell mentioned this, that he was concerned about sexual side effects and things like that. Doing the surgery, there's a certain amount of risk that goes with it. And depending on your overall health and your age, your risk of going through the surgery and having a bad outcome from that may be higher than your risk of the cancer getting you. So there are lots of guys walking around who have prostate cancer, and they're just being monitored. So they might come in every 6 months, come in once a year to get their PSA level checked. And if it's 13 and then a year ago and now it's still 13 or it's 14, probably you could watch it, versus going in and doing the surgery, because the surgery has a risk of we talked about erectile dysfunction, because they oftentimes will destroy the nerves that supply the penis, and so you have erectile dysfunction after the prostatectomy, removing the prostate. But also it can cause bladder incontinence. So you might have to wear an adult diaper. It can cause bowel incontinence. So there, and then of course any surgery, there's always risk for infection and other things. So there's a certain amount of risk that goes along with doing the surgery. And so you have to, that's why it's a conversation you really have to have with your doctor, and probably with I say your doctors, because you want to talk to your primary doctor, but you also want to have that conversation with the urologist, and maybe bring your family with you, someone who you trust, to help you make medical decisions, because it is complicated. And some of your options might be, you can do the surgery, you can wait, or you can do radiation. If you do radiation, you might not be able to do surgery later. And so, it gets very complicated.
Can I ask a question, Dr. Itzard?
Mm-hmm.
With the advancements in surgical techniques, and many surgeons use robotics now, can you comment, has that reduced some of that risk?
Yes, it has. I mean, definitely, the surgeries are safer in regards of, try to do nerve sparing surgery. So you're less likely to get the erectile dysfunction. But if you're that, even one of the few people that get it, it's. I mean, if you have cancer, at that point you want to live, and so if that means you have to give up, being able to have an erection, that's the option, that's the choice you make. But a lot of guys want, especially if you're younger, you want to avoid that. But the surgeons have gotten a lot better that they can spare the surgery, the nerves that supply the penis. The other thing is, and this you want to keep in mind, is that when you look for a surgeon, there's very clear evidence that shows the more a surgeon does, the better they get at that.
Mhm.
So you want to have a surgeon who's done many of those surgeries because they become more proficient at it.
Awesome. Thank you. That it's really important, and that's one thing that we talk about. You mentioned the conversation with your doctor
Mm-hmm.
and having that relationship so that your doctor can tell you the best the best options,
Mhm.
and then having a surgeon who does a lot of them.
Yes.
A lot of the surgeries is key. And Mr. Harrell, you mentioned that your doctor was Dr. C.
That's correct.
And that was somebody that he talked to you about it and gave you options and asked you what you wanted to do, which is having that communication and having that conversation was so critical.
Mm-hmm.
And we talked about it, and we cried about it, along with my significant other.
Mm-hmm.
And in the long run, it was a successful surgery. Everything turned out well. It started out bad, but then it slowly, doing the Kegel exercises and things like that, I got, control of the incontinence, and also the erectile dysfunction. It came back, and everything is okay today. I still every once in a while I still have to wear the pads and the depends, but hey, I'd rather do that than
Right.
we
Right.
did. Okay.
How long has it been now?
Since 2010.
Oh,
Then,
okay. So it's been a while.
right, and then 16 it came back, and so he went back in, and he had to go around the area
Mm-hmm.
that the prostate was in,
Mm-hmm.
and he did that, and ever since 2016, I've been cancer free.
Amen.
Awesome.
So,
And Mr. Harrell, if you don't mind, because you're a thriver, not just a survivor. Yes.
And getting back to
Please, yeah.
to Dr. C. Dr. C referred me to this group at they were having a meeting at the health department on, I think it was the health the one on 6th Street, and I met a lady named Dr. Stoley there, and Dr. Stoley was starting up this group called Men Moving Forward, and they had me. I was one of the first invitees for Men Moving Forward, but I had to wait, I think, a month or two until I think it had to be 6 months after surgery. So I had to wait a month or two. But I got involved with Ambrose Brown and what's the other guy's name?
Leonard Wilson.
Leonard Wilson, right? And Leonard Wilson, and man, we went through COVID with Men Moving Forward. We were doing virtual exercise and food and nutrition, and that's the whole thing about Men Moving Forward. It's not only just exercise, also nutrition. It's also life skills.
Mm-hmm.
We have people come in like Dr. Stoley and Miss Deborah, and come in and talk to us about different lifestyles, different alternatives to eating and things of that nature. And man, it was, and then they had me. Then they selected me to do things like this, come and speak and go to different churches. And today we're still doing the same thing with a group called the Health Griots. And the Health Griots are guys who went through Men Moving Forward. And now we go in a griot is African terminology for storyteller. And I'm good at that. I used to tell a lot of lies, but now I can tell stories. Today I can tell stories.
Yay.
But we go around and we tell our story of our journey through this cancer process. And man, it's just a wonderful program, man, because I see guys coming in younger than me, older than me, and man, it's just a thrill to be involved with and to help them and to kind of mentor them as well, because they're coming behind me.
Mm-hmm.
So
Mm-hmm.
I have to help lead the way. I have to help Miss Deborah with Ambrose.
Mm-hmm.
You have to help me with Ambrose.
With Ambrose.
He said it. I didn't. He said it.
But you know what he said that's very important is the idea of having camaraderie. You know, being agreeable, telling that story to other guys, hear the story. And so, if you go through this alone, you might be embarrassed to say, "Oh, I got to wear a diaper," or I have erectile dysfunction. But your other guys are saying that, I get this too, and then you don't feel as embarrassed about it. You take the stigma away from
We
it.
talk about sales. They got over 3 for 1. You go over here and get 3 for 1.
So go group shopping afterwards.
Yeah, but if you can get, because guys, women are a whole lot better at talking about the health issues than guys are. We don't like to disclose that kind of stuff, and for that reason, we're less likely then to go in and get our prostate checked because we're men. We don't got to worry. I'm not afraid of anything.
Mm-hmm.
But deep down inside, you are anxious about it, and when you hear other guys say, "Well, I was anxious about it too," it gives another level of honesty to the whole process.
Mm-hmm.
I think that's such a great point, Dr. Izzard. And Mr. Harrell talking about men moving forward. Part of the reason we started that program, right, was that we heard from Black men who had prostate cancer that they were very isolated in their experience, that no one was talking about it. And I had come up from Chicago where I had a program called Moving Forward for women with breast cancer to bring women together to heal and thrive. And they were really interested in lifestyle changes that would not only help them reduce their risk of recurrence, but also other diseases, diabetes, hypertension, be around for their great-great-grandchildren. And the guys, when we talked with them, what would you like after your prostate cancer diagnosis? First of all, they said, no one's ever asked me what I would want once I completed treatment. It was like, you're done with treatment, see ya, hope we never see you again. And they too were interested, the men just like the women, in coming together, camaraderie and lifestyle changes to, again, improve their strength and also be able to thrive psychologically and physically. And so that camaraderie has grown through Men Moving Forward. And Dr. Izzard, to your point about the stigma, we've had over 130 men coming through the program. It's now at Marshall High School. It's a standing program. It started out as a research study. So Mr. Harrell was one of our citizen scientists, I say, because you can't make discoveries if you don't have people alongside you. And that camaraderie, I hope, will reduce the stigma of people talking about prostate cancer. So men coming up, the young guys, right, who we want to start thinking about getting screened or at least having conversations with their doctor in their late 30s, early 40s, are having those conversations. And I wonder, Mr. Harrell and Dr. Izzard, your thought about how do we in Milwaukee particularly get the word out about prostate cancer and have people talking about the fear and the stigma and how we turn that and get this wave of really prevention and health promotion.
Well, I think we need to have more people like Deborah who will push the word out into the community on radio shows, TV shows. However we can get it done. We can even have commercials. I think commercials would even help. Public service announcements, those type of things, whatever we can do to get these guys. And I think, I really do think that the earlier they detect it, they go in, the better. So even if you're 35, I even tell them, you're 35, ask for a PSA. Let's have your PSA. And then how to get them in the habit of asking for it. When they go in and they get a blood test, well, what's my PSA? So, I mean, it's preventive. We're trying to do preventive measures here.
Yeah. And
one more thing.
Go ahead.
I didn't mean to cut you
No, go ahead.
But thanks for mentioning that, Dr. Stoley, because I have two great granddaughters on the way, and I'll get to see them. I will get to see my two great grandsons. I got grandsons, I got one granddaughter, but I'll have two
Two grades.
greats,
Blessing indeed,
two
right?
greats, yeah. And I can't wait. Spoil them to death
Yeah.
because they're granddaughters. Send them back to their parents.
There you go. There you go. So Dr. Stolly, we met a little while ago. She started this prostate cancer work group, and I was part of that. And we were looking at this whole question, of why is there disparity with prostate cancer deaths in Milwaukee? We know that black men with prostate cancer tend to have a more aggressive form of prostate cancer, and we tend to wait longer too to get diagnosed. And so, but what really sold me though, there's this heat map. So you guys have all seen heat maps are it's a map of an area, like you probably seen like when you watch the weather on TV and they show like storms coming up, and they might show the areas that are most impacted are red, and then it kind of spreads out as orange and yellow, and then there's blue areas where there's not much going on. So this heat map actually was looking at the incidence of prostate cancer in southeastern Wisconsin. So there were two maps. One was incidence of prostate cancer, and then the other was the prostate cancer deaths. And then the incidence, the number of cases of prostate cancer, it was fairly distributed, between Milwaukee County, Racine, Kenosha, Waukesha, Ozaukee County. But then we look at the deaths, these two big red areas in Milwaukee and Racine, Kenosha. And that's where you find the black folks. So, and it really bothered me. Why is this? So it's not like, in Milwaukee, there are a number. We got Freighted Hospital here. We got we got Ascension. We got Aurora. There's plenty of hospitals here. Mm-hmm. So it's not from lack of there being resources, but something else is going on that's causing this disparity. And I want to know, and so so now we're in another phase of this prostate cancer investigation. And in fact, we just came up with the name yesterday, the Prostate Health Equity Project.
Prostate, yeah.
Yep. And so now we're kind of retooled it. We have a grant to talk to men like Mr. Harrell, and to try to figure out what is it that we need to do to get the word out. Some of it's education, some of it's that you need to be screened, getting that word out. But then also what's going on after the diagnosis. Are people falling off because there's no one helping them through the process? Are they having problems getting referrals? Is there something about the cancer itself that's causing the disparity? So we still need to know these things.
I think Ms. Deborah's doing a good job of getting the word out, getting us to different churches, getting us to different events, health fairs. Juneteenth Day, it doesn't matter. Wherever we can put a table up, we put up a table, and we try to get the message out. We have flyers for not just prostate cancer, but all the cancers.
Mm-hmm.
We don't stop at prostate cancer.
Right.
It's cancer, period.
Right.
We're up against. And I lost two sisters with breast cancer, so I know that it's plaguing our community, and we need to have early detection. The earlier, the better.
Mm-hmm.
Mm-hmm.
Mm-hmm. I want to just step back with the Understanding Prostate Cancer Disparities Project. You had citizen scientists as part of that group, and those are community members who helped with the discussion around why the disparity, as Dr. Izzard was asking. And then after that discussion, then came the secondary project. And so this is one piece I really want to make sure that our community understands, is that the research and the way Dr. Stoley works is it should not be unique, but it is a way. we want to put something in the water so that everybody acts this way. But it's the way that research is done when you do it focused and with community.
Mhm.
And if there are community members who are interested in being citizen scientists, that if you contact me, we're going to begin creating a database of individuals who can go through a training on exactly what this type of research is and what it means to be a citizen scientist. And you also have another project, um, uh, community scholar. I'm saying it wrong.
Research community scholars.
Research
Yeah.
community scholars. Yes.
So all of these things fall under something called the Community and Cancer Science Network,
Yes.
which was started with the belief that disparities have been going on for centuries, really, and that everything that we, and when I say we, I mean a very huge
The royal
we, the
we,
country,
yes.
have not been successful. And so we need to have a different approach. And in the past, it was researchers working in their silo, community-based organizations working in their silos. There's something called community-based participatory research, which is super important. But even those efforts have not necessarily made the advancements that we would hope. And so there's something called transdisciplinary approaches, which is where you have people who are experts in different things and different lived experiences, and they come together. And this is what we did in our Understanding Prostate Cancer Disparity. So we had Dr. Izzard, who's a healthcare provider, and we had a basic scientist. So this is a lab scientist who works with cells in the lab, right?
Mhm.
We had a clinician urologist. We had a survivor. We had someone from the government. We had someone from marketing. And they all came and they learned about cancer disparities. And we talked about it and everybody brought their perspective. So the way the marketing person thinks about it is very different than I do.
Mhm.
But I learned things from her and from Dr. Izzard that I didn't know that changed how I thought about disparities. And so that's how you come up with more innovative solutions, because it becomes not just people contributing their expertise, but people changing the way they think and coming up with different kinds of solutions.
That's awesome. So on the other side, we're going to take a quick break. On the other side, we're going to continue talking about the CCSM project, but a program, and then we're going to talk about how evidence-based initiatives become programs, how we make that transition. We'll see you on the other side. Welcome back, family. Now, I know we've been talking here, but feel free to join in this conversation. You can call in at 414-444-5253 or 414-444-5250. Before we went to break, Dr. Stolly, you were mentioning a little bit about the work about around CCSN, and also the Understanding Prostate Cancer Disparities, the citizen scientist that sat around that to help that morph or help that develop into what is now the Prostate Health Equity Project, the FEP. The FEP.
I know, we joked about that.
The FEP.
Not a great acronym.
I like the acronym. We live with acronyms. That's fine.
Right.
There's been worse, so that's a good one.
Exactly, right.
It's a good one. But just talking about how this, and invite the community if you're interested in being a citizen scientist. I'll give my number at the end, and you can contact us because there's several different ways that this can happen. That you can be part of the solution
Mm-hmm.
by being part of the research planning component at the beginning, at the front end, to help us develop these magical questions. But you've done this research, Dr. Stolly, with Men Moving Forward, and with Everyday Counts. And now both of those programs are part of Milwaukee Rec.
So Everyday Counts is not. So let me
Oh,
just,
my
so Men
apologies.
Moving Forward, there's also a program called Total Wellness.
Total Wellness. That's
So
it.
once we heard so much about needs of cancer survivors, we also heard interest in cancer prevention programming. So we partnered with Milwaukee Rec, and we developed a cancer prevention program called Total Wellness, which is now offered at Milwaukee Rec. It was developed through lots and lots of community focus groups and feedback, and co-developing it with community members on the south side and the north side. And Total Wellness, you can sign up for it, Milwaukee Rec, $8 for 8 weeks. And it's education around cancer prevention, cooking demonstrations, and supervised exercise. It's an amazing program. And Men Moving Forward, which is a program for prostate cancer survivors, is also now available. $8, 8 weeks. I think it's actually $12, 12 weeks in the fall, because there are 12 weeks, but it's $1 a week. And you get the this fully structured program that helps people navigate survivorship and improve their diet quality, so how they're eating, learn how to strength train, and also do moderate physical activity twice a week with Leonard Wilson, who's one of the top personal trainers
Yes.
in the city of Milwaukee.
Yes.
So if you were seeing him on your own, you'd be paying like probably
Much
10
more.
times that,
Yes.
if not 20 times that for an hour. And also there's an incredible thriving group of men who are already involved in Men Moving Forward. So you as a cancer survivor could join and have this instant group of men who have been through an experience like you. And it was important, Deb, to take research. I'm a researcher. I believe that it is important that things we do be grounded in science. So, there's a lot going on now to question science.
Mm-hmm.
And I think Dr. Izzard would agree that when we say it's important what you eat, we're not just saying it because we think it's a good idea.
Right.
It's because there's lots of evidence to show that eating more fruits and vegetables and eating less red meat and processed meat and exercising and building your muscle leads to better health outcomes.
Yeah.
Mm-hmm.
Yeah.
Mhm.
Yeah.
Right.
And going back to what we talked about earlier, before the break, just when you get that diagnosis of prostate cancer, how well you do, how well you survive any kind of procedure they do is going to depend on what your baseline is when you start. So if you're coming in and you're already frail and you already have a lot of problems, then your chances of having a successful prostatectomy is a lot lower than becoming strong and healthy. And so, and after your diagnosis, and Mr. Harrell, I'm sure can attest to this, there's a big emphasis now on, okay, you had this cancer scare, we got to get you healthy. So, so you got to think about everything, like your diet. Is your diet part of the reason why you got prostate cancer? Are you sleeping? Are you, is your just overall health good? And so that's why we're doing all these other things. And Mr. Earl also alluded to this too, is that we don't just want to talk about prostate cancer and end it there. We want to talk about just men being healthy in general, and you can talk about blood pressure. We can talk about stroke. We can go any number of different things that are killing us. Prostate cancer is just one of them. And so we got to get overall healthier in general.
Definitely, definitely. And that's one thing we are partnering with. One of the projects that you all are working on is with the Pin a Brother program. And that is a program that kind of helps with accountability. And Dr. Stolle, can you talk a little bit about your work with that?
Yeah, so Pin a Brother grew out of actually a very successful program in Chicago that Access Health began. They are a community health center where they partner with churches to increase awareness about cancer, and in particular breast cancer and prostate cancer. And when I came up from Chicago to Milwaukee, I thought it would be really great to talk about the possibility of implementing that here. And a great person, Lauren Matthews, who worked with me, really took the lead in this. And now Melanie Burns and the Griots are helping with this. And Pin a Brother is where churches sort of feature prostate cancer in their service. So, for example, September is Prostate Cancer Awareness Month. Some churches choose to do this over Father's Day, but it's really this idea of, our bodies are our temples, and ideally the pastor works health into their sermon. You have a survivor testimonial, but most importantly, the men in the congregation turn to each other and commit to support each other in getting the screenings they need. And it doesn't have to be focused on prostate cancer only. It happens to be a blue ribbon, which is prostate and colon.
Yes.
So you can sort of check off 2 boxes at once. But it's this idea of social support and community support and social cohesion. And those are things that drive good health. You can't do it alone.
Definitely. And we're utilizing the health griots. One of the ways is because, as Mr. Harrell can attest to, one role that the griots play for our program is that they use their natural connections in the community to get the word out to other men and the community in general. And Mr. Harrell is one that, as he mentioned early he glossed over early in his introduction, he is a pastor. And one of those things is the connection with other churches. And when we asked them to reach out to their connections, many of the griots reached out to churches that they were affiliated with, or even other men that in their affiliation with churches. And that was some of our early work with the griots, was to work with men's ministries. And so this natural fold of, okay, now let's look at Pin a Brother. And Mr. Harrell, the education that you're doing in the community and then linking this to churches, it seems like a natural fit to what the griots are doing. What are your thoughts?
Well, for one, I have to interject.
I'm sorry. Go right ahead.
I'm a minister.
Minister,
I
sorry.
do prison ministry.
There you go.
Okay. And doing the prison ministry, I work with a lot of guys who are in the reentry, coming back into the community.
Awesome.
So that's one of the main things that I try to get them to do is to get out here and get your exam, get your PSA.
Awesome.
And talk to my pastor about the Pin a Brother, right? And we had a big breakfast. He likes to do things big time. But we had a big breakfast, and we were talking about it. And he was all for it, but he wants to do a whole health program, a whole health fair. Now he wants to make
Now you've done it.
Right,
Now you've done it.
Right. He wants to, and I told him about, well, I don't think we want, they just want to come in and talk about cancer disparities and prostate cancer. And he said, oh, well, we can do this and we can wait till
turn them over to Melanie. But yeah, that's we want to support. Part of what our program does through community outreach and engagement, we support through the work of Melanie Burns, we support health ministries. And I tell people all the time, our focus, the focus that we have is on cancer. But don't forget, we're part of the Medical College of Wisconsin. I can find any topic that you want to talk about, and hit up a department and find out. One we had during COVID, we had a church that wanted to talk about the psychological impact of COVID on children as children started to go back to school. And we reached out to Children's and found, I think, Miss Keisha, who was a psychotherapist, who was able to do this session for the church, which was very, very helpful. So we can support health ministries. That's part of the work that we want to do within the churches. But your primary focus is to try to get the Pin a Brother programs to go in the churches. And then be able to support it beyond that.
So you guys heard that. So Deb Nevels said that if you got a program, a special interest, any health issue, contact her and we'll find somebody to help you with it.
We'll get Dr. Izzard to come out. No,
but as a family doctor, that's one thing I love about my job is that it's never boring because I was talking with a guy a couple of weeks ago who's newly diagnosed with prostate cancer and, kind of helping him through the first steps of the process. But, I got guys with high blood pressure. I got someone who just had a heart attack, a young guy who's 57 or 47 who's had a heart attack. I'm dealing with, with all kinds of stuff. So it's not just one urologist. They deal with, urological problems, prostate cancer, but I get to deal with all of it. And so, it's not just trying to treat your prostate. It's trying to treat your whole life,
the whole person,
a whole person, because, the prostate is in a person and that person lives in a community and has a family. And, so all those things are important and they all feed into how well that person survives this cancer, And so, and the church is a huge one, So, what your social network like? Who's around you? Who's encouraging you? Are you just hearing negative things? Are you secure in where you live? Do you have food security? I mean, all those things. You can't it's like a ball of yarn. You can't pull on the string without it being involved with twisted with other things that are going on.
Definitely. And that's, Dr. Stolle, I want to tie that back into the premise behind the work that you're doing with Men Moving Forward and Total Wellness, with lifestyle changes. And that lifestyle change, can you speak to a little bit about how that impacted the work that you did and continue to do with Men Moving Forward and some of the other projects that you work on that focuses on lifestyle?
Well, I think to Dr. Izzard's point, people don't live in an isolated situation, right? And so I get this pushback a lot that, well, lifestyle depends so much on what you have access to. Do you have access to healthy foods? Do you have access to safe places to exercise? Do you have access to people to show you how to exercise? We all think it's so easy to just go out and start strength training. Well, no, it's really easy to injure yourself if you're not doing strength training correctly. And it's also can be, once you could have all the access in the world to healthy foods, but what if you don't know how to cook them? We had a woman in our Everyday Counts, which is a lifestyle program for women with metastatic breast cancer. So that is breast cancer that has spread outside the breast. It is incurable, but because of advances in treatment, women are living very long and lifestyle matters. And we're looking to see how does it matter at the cellular level. And she joined this program and we had cooking classes. And she said, I could never have gone plant-based. I always wanted to eat more plant forward. Because people assume plant-based is vegan, which it's not. Just means cut back on your red meat and processed meat. Because she didn't know how to shop for vegetables, fruits and vegetables, how to store them, or how to cook them. And so there's all sorts of assumptions that get made about, oh, it's easy, right? I know Dr. Izzard doesn't do this. I'm sure he doesn't have patients who come in and he says, you just need to lose weight. Okay? How many How many
Please don't say
patients
that.
say,
Yes.
like, yeah, just go home and lose weight? Oh, okay.
Okay.
Right.
Right.
Like,
Yeah.
I wouldn't have done that without you telling me that. And how hard behavior change is. Not
Yes.
only is it access and knowledge, but it's also like behavior change is really hard.
Mhm.
Yes.
Habits are formed. We all get up, we do certain things, we get in our cars, or we get on the bus, or we walk to work. I
Mhm.
mean, making those behavior changes, I can tell you as a psychologist, is the hardest part. And what we try to do in our programs is give people tools, psychological tools
Mhm.
that help you enable behavior change. Things like, this is a fancy term, stimulus control.
Mhm.
And that basically means set up your environment so
Mhm.
to succeed, right?
Right.
I had a lady in my breast cancer project. She loved Dunkin' Donuts. Every day on the way to work, she'd get like some, I don't know, caramel macchiato thing with donut.
Yeah.
And we talked about it in the group. And she's like, you know what I'm going to do? I'm going to take a different route to work. So I don't go by there anymore. Guess what? It worked.
That's pretty
It
much.
sounds so simple, doesn't
Yeah.
it?
Yeah.
People
does.
don't think about those
Mhm.
things.
Mhm.
Mhm.
You know,
Yes.
Dr. Stoley, you just brought it to mind. Me in Narcotics Anonymous, there are different, we cover not just narcotics, we also cover alcohol. We also cover eating disorders.
Mhm.
We
Yep.
also cover sex addicts,
Mhm.
sexual addiction. We cover all of this. And so it's like a holistic
Mhm.
Mhm.
It
coverage.
is.
So what we're doing here is sort of similar to that. It's
Mhm.
like holistic.
Right.
It's the whole body, not
Mind,
just
spirit,
Right.
body.
right.
Yeah. And another area that we often neglect is stress.
Yes.
Oh,
Because
gosh.
stress
Don't
plays
forget-
a huge amount.
Overeating.
Oh,
Yeah.
yeah. And,
Stress.
right, yeah, right. People respond to stress in different ways. It may be overeating, it may be sexual addictions, it may
Right.
be other kind of AODA
Doom
issues.
scrolling.
Yes,
Oh,
yes.
gosh.
Yeah, that's
On your phone, yeah.
What in the world is that? I know nothing about that.
Yeah. Yeah. So and as as America
Mhm.
gets more divided, there's more stress, and that affects your health. In on a cellular level, we don't. There are hormone levels that change, based on your sleeping and your stress level, and that affects your weight. And so you start gaining more weight. Now that becomes a problem, and it becomes this vicious cycle
Mhm.
that you're in. And so, and especially living in, when you live in a city, there's a certain amount of stress that goes along with that.
Mhm.
Ooh, ladies, don't forget shopaholics.
What do you mean, ladies? Have you met my husband? But yeah, and those things it's difficult. But like you said, all you do, she just took a different route.
Mhm.
It just took a different. I had this addiction with Starbucks. I'm sorry, the coffee place, the other coffee place, and yeah, and it was like every day, every morning, and all that I had to do was add up how much money I was
Wow.
spending going. I was like, wait, that's a tank of gas.
Yeah.
And I'm going out of my way to go get it because it's not on my route. And so I started. When I got married, my husband bought the coffee grinder, which made just smelling that in the morning was wonderful.
Uh-huh.
And then we found really cool creamers that we liked, and it was so much better. But it was a healthier habit because now I'm not spending $6 or $7 or $10 when I go through and get coffee
Yeah.
all fancy, and I've been able to curb that a little bit. But
Yeah.
yeah, it's that healthy lifestyle, the choices that we make,
Mhm.
and also being able to define it. Like you said, when you talk about plant-based, immediately everybody thinks you're talking about becoming totally vegan, not eating meat at all.
Right.
But it's a reduction, and it's slowly being able to reduce it.
Yeah.
And even with the Men Moving Forward project, you talk about moderate changes. So, okay, I've learned this from last week. Mr. Harrell, how many push-ups? Is it push-ups that you all do?
Mhm.
How many do you do?
I do mine on the walls.
That's okay.
It's all right.
I've learned.
So I
I've
can
learned
do
doing the wall. I've started doing those after.
I can do 100.
You can do 100 on the wall,
50, 50.
50 and 50. Whew, okay, y'all look
But
good.
think about how small changes matter
Yeah.
everywhere. I think even with our prostate health equity project, to string all this together, to make a change, right? There's the individual change we talk about in lifestyle, But it's going to be hard for people to make lifestyle changes. There is a systems change where things are made available and it's
Right.
easier to, find food, to reduce your
Mhm.
stress, to think about
Mhm.
changing your behavior, to get the support of others to applaud you.
Mhm.
But then there's even bigger systems change
Mhm.
around prostate cancer, I believe, that needs to happen, is building community awareness. I'm going to use this word cohesion, which is people
Yes.
coming together and realizing that we are sick and tired of Black men dying of prostate cancer unnecessarily,
Mhm.
right?
Right.
And yes, part of this is discoveries around treatment, but 95% of men, right, who are detected early
Mhm.
survive their prostate cancer,
Mhm.
Right.
right?
Right.
Right.
So it's not about necessarily the treatments. We have really, really
Mhm.
great treatments for
Mhm.
prostate
Yeah.
cancer.
Mhm.
We got to go upstream. We got to look at
Right. Right.
what's going on in Milwaukee
Mhm.
that men, like in Men Moving Forward, this was like such a lights on moment for me. And the guys in Men Moving Forward brought this to my attention. Most of them were diagnosed with their prostate cancer at their with symptoms. So they had never had a PSA. Okay?
Mm.
At least the early phase.
Yeah.
So what does that say? Now we know there's lots of confusion around screening, and I think Dr. Izzard is so articulate and informative. I've learned so much from him about prostate cancer screening, and maybe after the break we can learn more about
Definitely.
that.
Definitely. We'll talk a little bit more about that on the other side. We're going to take a quick break. Thank you so much. We'll see you all on the other side. Welcome back, family. Now, when before the break, Dr. Sally, you were talking about
Prostate cancer screening. And we were going to
Screening,
ask Dr.
yes.
Izzard to give us his wonderful explanation.
So, as a family doctor and someone who does primary care screenings at a very regular basis, I have a conversation with all my guys that are over 45 about prostate cancer. It takes longer to do this talk, to explain to them why I'm doing what I'm doing than to just do it. And that's why I think a lot of guys have problems with it because if I ask you, do you want to be screened for prostate cancer? First thing you think of is the finger in your rectum, and you said, that's okay. Well, we kind of got away from the digital rectal exam and going more with the blood test, the PSA blood test. But the problem that we have is this, and this is another reason why I've been so involved with this prostate cancer and equity project, is the idea that I don't know really the best treatment for guys. And I'll explain why that is. So there was a big study that was done in the like 2010, somewhere around there, looking at prostate cancer. And the question was, were we over treating prostate cancer? And he said, that's a cancer. Well, get rid of it. Well, we know that getting rid of the cancer, doing the surgery, at least doing the prostatectomy, had risks like erectile dysfunction, bladder incontinence, bowel incontinence. So we knew all those things were going on. The problem, though, is that we didn't know exactly what guys we should be watching and which ones we should be aggressive and taking their prostate out. And early on, it was that if you have prostate cancer, we remove your prostate. Well, what we found was that when we started screening for prostate cancer back in the early 2000s, we started screening universally all guys for prostate cancer. What we found was that we were diagnosing a lot more guys with prostate cancer. But the number of deaths every year was not going down, which kind of implied that a lot of guys with their prostate removed were removing these slow growing cancers that probably would not have killed them. So that again, that implies that we're over treating prostate cancer. We're taking prostates out that wouldn't be a problem otherwise and causing problems in the meanwhile. So this big study, it was actually the PLCO study. They looked at prostate cancer, but also looked at lung cancer and colon cancer and ovarian cancer. But in the prostate arm of this, what they did is they took 30,000 some guys, and every year they were in the study group. Every year they did a PSA blood test, they did a rectal exam, and they followed them over a 10-year period. And to be scientifically responsible, they had a control group that they 30,000 some guys equally matched, and they did not screen them. They only got checked if they had an issue. So they followed these two groups of guys over a 10-year period to see what difference they would find. Well, what they found was that the guys that were in the study group, the guys who got the rectal exam and the PSA blood test every year, they were more likely than the control group to have an elevated PSA detected. Not surprising because they were screening them for it. Because of having an elevated PSA, they were more likely to get a biopsy done. Some of the guys got biopsy-related infections. They're treatable, but they're more likely than the control group to get a biopsy-related infection. They were more likely than the control group to be diagnosed with prostate cancer and then to have their prostate removed. And like we mentioned earlier, that group, they also, because they had their prostate removed, they were more likely than the control group to develop erectile dysfunction, bladder incontinence, and bowel incontinence. The problem, though, is that over that 10-year period, they followed these two groups. The guys in the control group, the guys in the study group, the guys who got checked every year, did not live any longer than the guys in the control group. So this is why we're in this pickle right now, because there's an organization called the U.S. Preventive Services Task Force, and they make recommendations about screening tests like mammograms and pap smears and colonoscopies. So they're recommending that every guy over 50 should be getting a prostate exam every year. But then after they found the results of the data from this study, they said, and this was also replicated in the UK and then in Australia. So it wasn't just the US. This was like a universal thing. So they said we can't really recommend this as a screening test because there are clear harms of screening. meaning that if you were screened, you were more likely to have a bias-related infection. You're more likely to have erectile dysfunction, bladder incontinence, bowel incontinence, and then the stress of being diagnosed with cancer, but there's no clear benefit because you didn't live any longer. So they changed the recommendation. And this was about 10 years ago now that they changed that recommendation, kind of shook things up. And so what happened was a lot of doctors stopped doing prostate exams because they said, well, the recommendation went away. Having a conversation took a long time to explain to guys why they weren't going to do it. So they just didn't do it. And so, or a lot of guys were opting not to do it. Now we're seeing a bump in prostate cancer deaths again. So we don't know if it's all related to not screening, probably is, but we don't know where that sweet spot is between not doing, being aggressive, too aggressive, and taking out prostates and causing problems from that, or or just not screening at all. So what's more likely to happen now is that if you have an elevated PSA blood test, we're more likely to say, let's watch it. What it's called expected management. So you would come in every 6 months or once a year, and we check your PSA blood test. And if it was 13 last year and it's 13 again this year, then it's probably not spreading, it's probably not being aggressive, and so we can continue to watch it. If it was 13 last year and it's 26 now, then we think, okay, this is doing something. Maybe we should be more aggressive with it. But again, that's a conversation you kind of have to have with your doctor as far as, should we be more aggressive? If you're younger, we're more concerned because one, you got a longer life, and two, it tends to be more aggressive and young. If you're, like say, if you're 50 years old and you have an elevated PSA, is different than if you're 75 and you have an elevated PSA. One of the other issues that came up, and this is the thing that really is kind of twisted my noodle, is that we look at Joe Biden. Okay, Joe Biden has got probably the best doctors in the country. How did he get prostate cancer, metastatic prostate cancer? Well, probably what happened is he's 82 years old. Probably what happened was at 75 they stopped screening because that was a recommendation.
Yeah.
So he probably had almost 10 years. He could have had prostate cancer at 70, 75, 77, and it's gone 5 years without any kind of treatment because no one is screening for it anymore. And so some of that we have to change is not just an age, but we have to say, okay, what is your overall health and what's your life expectancy? Because if he were the average 75-year-old and he only had 5 more years left of life expectancy, well, then it wouldn't be a big deal. But for someone who might live to 100, that's a whole different story. So there's a whole lot of things you have to take into account when you're doing these screenings and these recommendations. It's not one size fits all.
And I want to bring up that the Prostate Cancer Foundation, which is a national organization, came out with guidelines for Black men only for prostate cancer screening. Because when you looked at what happened when the United States Preventive Task Force gave PSAs a bad rating, in fact, the research shows that the impact was greater among Black men and men with family history. Because they were not getting the screenings.
Right. Yeah.
And so what we're trying to do with this prostate health equity project is really raise awareness again that you got to be talking to your doctors. But even doctors sometimes are confused.
Right. And so, so when I screen guys, should I be screening my Black patients different than my white men? Or should I be making recommendations differently for my Black men than my white patients? Because we do know in Black men, African American men, that the cancer tends to be more aggressive and it tends to be further progressed than white guys when they first appear with their cancer. So again, I would like to know this, and the only way to know this is to do these studies. And so this is where you guys come in, because the only way they can do the studies is to get guys to enroll in them. And so that's why I wasn't really involved so much with all of us, because I do want this information. We got to be, if we're not enrolling in these studies, if they're not looking at the data with us in mind, then they're making recommendations without us in mind.
Right.
And so I was to say, if you're not at the table, you're on the menu. So we got to be involved in these studies. And so, which probably brings me to another point where we talked about this prostate health equity project. So we're actually doing what's called an idea lab. It's we talked about the marketing thing arm of this. Well, this is a chance for us to get an idea from people. What is the best way to get the word out about this? Is it doing commercials? Is it talking to church groups? Is it should we be focusing more on the primary care provider? Do you even have a primary care provider? So, we need to be looking at all those things. But we're doing a idea lab next Thursday. So if you're sitting out there thinking, yeah, they should be doing that, or I got some ideas, then we want you to come and say. So right now it's by invitation. We got some guys that we recommended, just based on either they've had prostate cancer before, or they've been involved with us before. But we do want to open it up. And if you're one of these people that really, this excites you, for whatever reason, and not just men too, it could be women, family, other people who might, maybe your dad died of prostate cancer and he waited to the last minute, and you got some ideas about how to better approach that. And we're having this idea lab to kind of to tap people's brains and find out what's the best way to approach this. So it's going to be at Thrive On, which is on King Drive. And it's going to be 5 to 7 o'clock. So I'm going to let Deb, because right now the person who in the office who would be the contact person is out for 2 weeks. So this is on Thursday. So I'm going to let Deb be the contact. If you can't get Deb, and Deborah will give you her number. If you can't get Deb, then you can call the station and they can take the info.
Yeah, if you are interested, the number that you should call, two numbers. One is Jamie, and Jamie's number is 414-955-4095.
Let me just say, if you call that number, you will hear that it's the Men Moving Forward and Melinda Stolley line. So just leave us a message there, and Jamie then will call you back.
Yeah, so please, if you're interested in the Idea Lab that's being held September 11th from 5 to 7 p.m. at Thrive On, you're going to call the Men Moving Forward Melinda Stolley Lab. That phone number, 414-955-4095. Also, on that same day, we are having a town hall. It's actually the Milwaukee Road Show. We're doing in collaboration with UW Carbone Cancer Center, and that's in the morning, also at Thrive On from 10 until noon. And you can contact me at 414-955-2364. And you can contact me if you are interested in attending that event or any of our upcoming events, or if you're interested in getting in touch with the Health Griots, you can contact me and I will make sure that I connect you with anything that we can assist and support you, your health ministry, anything like that. We are definitely interested in collaborating with you. One thing, so we talked a little bit about research moving to evidence-based programming.
Mhm.
And I use the words and I didn't quite define it. And I want to make sure that we do have a moment. So when we say evidence-based, it means that research was done and it was shown to be effective.
Mhm.
And one of the key pieces, circling back to Mr. Harrell, one of the key things with any type of chronic illness diagnosis is the impact of isolation.
Mm-hmm.
And the camaraderie that the guys have with the Health Griots and with Men Moving Forward. I'm sorry, Dr. Stolley, just that camaraderie and that the importance of that connection in the work that you've done over the years has been so key and so important. And so can you just speak briefly to that idea of the isolation during cancer diagnosis?
So I'm a clinical psychologist. I got my start really working with cancer patients after their diagnosis. And I started this at a time when no one talked about cancer, right? People got diagnosed. It was like they were ashamed of it, as if they had done something. And I'm going to turn this over pretty quickly to Mr. Harrell, because I think all I did was listen and hear what was important to the survivors I was working with. But Men Moving Forward and Moving Forward in Chicago, and now we have Everyday Counts, which is for women with metastatic breast cancer, they happen because the men believed in it. They believed in each other. They believed in the power of the program, and they made it what it is, right?
Yeah.
So you plant a seed, and hopefully, you wait for water and sun. And Mr. Harrell and all the men who participated in Men Moving Forward, Leonard Wilson, just one of the most outstanding people I've met in my life. Ambrose Wilson Brown, another coach. It's just, and Milwaukee Rec, which is this incredibly rich resource in Milwaukee that believed in partnering. We showed them the evidence, the program works, and now they're like, sure, we'll offer it for $1 a week. You can believe that program costs more than $1 a week, right?
But to make it accessible, that was what was key. That was what was key. So, Mr. Harrell, if you can speak briefly to what you believe is the value of the work you do.
Well, okay, Dr. The main thing is getting the word out. For me, prostate cancer is a silent killer, just like the movie. It's a silent, but it is. It's a silent killer, and you don't know you have it unless you test, unless you get tested. And the main thing is to push the testing. So we have to educate. We have to broadcast. We have to alert the community that you don't know until you are diagnosed. I mean, until you get it checked, you have to get some type of diagnosis. And diagnosis don't always mean it's bad.
Right.
You can have a good diagnosis as well, but you need to be diagnosed, man, so that you know that you'll be around for your family. You'll be around to see your grandchildren and your great grandchildren. Right. And man, there's already a lot of how do I want to say it? There's a lot of issues in our community that stifle the Black community, that cut our lives short. Not only is it gun violence, is accidents and diseases and all these other things. So that, I mean, a little bit of prevention may go a long way and may let you live a little bit longer.
I do want to say and emphasize, because I know we're coming to the end here, but that Men Moving Forward, if you are a man who was diagnosed with prostate cancer, and actually we're opening the program up at this point to any cancer, it is available at Marshall High School. If you go onto the Milwaukee Rec website, or you stop by Marshall, you can register for the class. $12, 12 weeks. There'll be friendly faces
$1 a week
waiting for you, $1 a week, right? And a great coach. And if it's not this season, think about it for the winter season or the spring season, it will be there. And the early results of the program. So we did a research study on this, and we have just started to analyze the results. And indeed, we saw improved diet. So men were eating more fruits and vegetables, particularly vegetables, which is what you want. Improved strength, more muscle, which is super important. We don't realize how important muscle is for our health. Okay.
Right.
And I'm trying to think of the other things. We haven't looked at quality of life yet, but we do know the men have created these wonderful friendships. We have our griots all came out of Men Moving
All of
Forward.
them.
Right?
All of them. Yep.
So sign up, Total Wellness. If you are not a cancer survivor, Total Wellness is also in the Milwaukee Rec booklet.
Awesome.
And taking a quote from Leonard Wilson, "You can do this."
Well, I want to thank all of our guests today. If you have any questions, please feel free to reach out to me. That phone number, 414-955-2364. Key message for today: men's health is community health. Addressing cancer prevention among Black men isn't just about reducing disease. It's about preserving fathers, sons, and leaders, and ensuring stronger, healthier communities for generations to come. Thank you, family. We'll talk to you next time.